Okay, good evening and welcome to everybody. I'm Helen O'Dell-Miller from the Cambridge Institute for Music Therapy Research here at Anglia Ruskin University. And I'm going to hand over now to Kira, who is hosting tonight, and I'll be the chair, but she's kindly helped set all this up, and she's one of our PhD students here. So Kira, over to you for the housekeeping, and then we'll do some more introductions.
Yeah, so hello everyone, thank you for joining us today. We are having a webinar talking about advocating through educating with the Music Therapy Academy. So my name's Kira and I'm a PhD student from the Cambridge Institute for Music Therapy Research. Firstly, before we start, I'd just like to introduce you to some of our Zoom features. So only the speakers can share their audio and video. Attendees, please use the chat to introduce yourselves and where you're from. And you can also use the Q&A function to ask questions and also upvote other attendees' questions. And these will be put to the speaker at the end of the presentation. If you are using social media, please use the hashtag CIMTR and follow us on Twitter at CIMTR_ARU. And after the webinar, we will also send a link to a survey. So please do fill it out to inform future events. And finally, so I'm now going to hand you over to Professor Helen O'Dell-Miller, and the Director of Cambridge Institute for Music Therapy Research, and she will introduce our presenter today.
Okay, hello again, and this is our the first of a series where we're featuring our alumni who have moved on to leading positions in the fields all around the world. I'd like to welcome you all. I can see there are people from all over the world here tonight, so that's very exciting, and we hope you'll continue coming and join us for these really exciting series. Just a little bit about the Cambridge Institute for Music Therapy Research here at Anglia Ruskin University. And we are very linked also to the Master's Programme for Music Therapy and Drama Therapy. And I'd like to say this is the first of the semester and of this academic year, and so welcome especially to new students and new members of staff and to all. In our institute we have various projects running. Some are across different countries like Homeside, and then also we have a project called Radio Me, and those are in the field of working with people with dementia. And we have 5 research areas. We have about 17 PhD students and groups of researchers in these different themes. And we're focusing at the moment on healthy aging and dementia, music therapy and neuroscience, neurorehabilitation and stroke, mental health, and children and young people and families. And I think it's very exciting tonight that our first speaker probably will cover many different areas that will straddle all these areas and more. And I'm delighted to welcome Rachael. Rachael Finnerty did her master's training at ARU, and we're really proud to see her leading and setting up the academy that she's founder of, called the Music Therapy Academy, which is well known. And they have been very prominent during the last couple of years, especially during the times when we've needed to link up virtually. Rachael returned to Canada after doing her master's training at ARU in 2001, and she's since worked in hospitals, long-term care facilities, and a private studio, initiating over 30 new music therapy programs. She served as the president of the Music Therapy Association of Ontario from 2010 to 2014, and was recipient of the YWCA Women of Distinction Award for Healthcare in 2015. An advocate for educating people about music therapy, she brought 2 music therapy courses to McMaster University in 2010 and currently educates over 3,000 students each academic year about music therapy. To provide further education to the community and healthcare professionals, Rachael launched the Music Therapy Academy in 2016, and she's completed or is completing a PhD in psychology, neuroscience and behaviour. And I'm sure that you're going to have a really informative, exciting time listening to her work. And once again, congratulations on everything that you've achieved, and welcome, Rachael.
Thank you. Thank you very much for the warm welcome and for the invitation. It's really exciting to be a part of this series and launching this academic year. I will share my screen to get started. Okay, thumbs up that you can see my presentation. Lovely, thank you. Great. Well, welcome to this webinar, this workshop presentation, Advocating Through Educating. As mentioned, my name is Rachael Finnerty, and I am an alumnus, as mentioned, of Anglia Ruskin University and the founder of the Music Therapy Academy. Bernice Chu is also an Anglia Ruskin University alumnus. She is the Director of Communications with the Music Therapy Academy. She's not able to join us today as she is on the front lines doing music therapy in a very new and exciting position. But she is my co-presenter in spirit today, as she was an integral part of putting together this presentation. The Music Therapy Academy was created in response to healthcare workers and community members wanting to know more about music therapy, and as well as how to use music within their own scope of practice for non-music therapists, as well as professional development for music therapists. The Music Therapy Academy organically became a voice of advocacy through its educating. And publicly accessible platforms educating about music therapy are essential for the continued growth of the profession of music therapy. The Cambridge Institute for Music Therapy Research, facilitating these public lecture series, is an excellent example of advocating through educating. And again, I'd like to say thank you to Dr. Helen Odell Miller for having us here today. So who is the Music Therapy Academy team? Well, you have already met myself and Bernice virtually, and I would like to introduce you to Maya, our consultant. Maya co-launched the first workshops by the Music Therapy Academy and now provides us with support and direction in attaining our goals, right? Dream work makes the team, or teamwork makes the dream work. So I think it's both interesting and important to mention that I came to meet these two fabulous women through my role as an educator. I was teaching within the music therapy program at Wilfrid Laurier University in Ontario over 10 years ago when Bernice was a student. And I met Maya over 7 years ago when she was a student at the at McMaster University. And and I think it's both, So what I wanted to say is that meeting both Bernice and Maya in these settings of education is a really natural way to foster relationships. So together, this team, hashtag, raises the bar in healthcare through professional development, mentorship, and community science. And that's what we're going to be talking about today in regards to educating, advocating through educating. So first of all, the Music Therapy Academy has a large community that includes music therapists, healthcare professionals, musicians, and members of the community. So who are we aiming to educate in order to advocate? Well, everybody. We want to reach everyone. The more diverse our community, the more effective we can be in advocating for the use of music therapy. Non-music therapists need to understand the difference between how music is used within music therapy and how music can be used within one's own scope of practice, as well as how music therapy is different from using music therapeutically. And of course, we also aim to facilitate the learning of music therapists. Music therapists, as we know, need to continually build our skills and to add tools to our toolkit about how to talk about music therapy, how to articulate that music therapy is different from a healthcare professional using music within their own scope of practice, as well as building our clinical skills and keeping on top of research about the efficacy of music therapy in order to advocate. So Bernice, as our Director of Communications, she takes on this role. This is one of her main roles in advocating through education, is through the use of social media. So social media is accessible to almost everybody. And whether you like social media or not, it can be our ally in educating about music therapy as a means to advocate for music therapy funding, music therapy awareness, and music therapy research. It's also a great way for us to support one another. We need to share what each of us are doing. And the Music Therapy Academy, for example, reshares and promotes posts from music therapy associations, music therapy practices globally. And opposed to reinventing the wheel, we can learn from one another. What are other people posting? And if it helps to advocate and educate about music therapy, then reshare it, repost. We can broaden our audience by building upon sharing through social media. At the end of the day, we're all singing the same song. And the more voices that can join in, the louder we can be. So social media is a great tool for this. Now, the Music Therapy Academy did not set out to provide a mentorship program. This is something that very organically came about from people asking for volunteer opportunities or for supervision on a project course. And we're really glad that it did organically come about, because it's an incredible part of being able to educate and advocate, because now we've got this incredible team to do more research, to work on projects, which I'm going to be sharing with you today. Mentorship is a huge part of educating and advocating that I believe is really underutilized, not only in the field of music therapy, but within many professions. Mentorship is different from an internship or supervision. It's not being done to complete a qualification. It's a relationship initiated by an individual who wants to learn and further enhance their skills, such as providing support. If a music therapist is new to building a private practice, they may want some mentorship in building their private practice. If a high school student or university student isn't sure if they want to pursue music therapy, it's a way that they can learn about it. So overall, we work with music therapists as well as high school and university students in this platform of mentoring. We basically have two paths of how one can engage in the mentoring. One is taking part in research studies, and the other are seasonal or on-call mentees who work on various projects, community science, social media, these kinds of ways to communicate with the broader audience. So the mentorship program is quite flexible. And mentees may want to engage in research, such as a feasibility study or a systematic review, or the mentee may want to learn about music therapy through researching a topic for a blog or a video. So currently, for example, this isn't yet completely finished, but we're near completion. But one example is one of our mentees is currently working on a documentary about music therapy in the province of Ontario here in Canada. And this has been a great way for him to learn about the different music therapy programs that exist in Ontario. For example, which hospitals provide music therapy, which day programs have a music therapy program, which long-term care facilities offer music therapy to their residents, how many different private practices are there in Ontario, which kind of work are music therapists doing. So in this documentary, the mentee has been able to meet with different music therapists and to interview them. When he started his mentorship with the Music Therapy Academy, he was in high school. He was just finishing high school, and he is now completing his undergraduate degree in music therapy. So on one hand, this is a great learning for the mentee. And on the other hand, we're going to have this great product, this documentary that is going to help the broader audience know about where is music therapy in Ontario? What is happening in this province in regards to music therapy? Where are people working? So it's going to be a great tool for advocating. So again, just making this point that these two pieces go hand in hand. So I wanted to share some examples of the research projects that mentees have done. So there's been many, and I'm just highlighting a couple here. And the most recent mentee project research that has been completed through the mentorship program is a systematic review for the use of music to manage stress and anxiety during COVID-19. And so some of the research that's done is prepared for journals for submission, while others is research more for general learning. It's research that is contributing to gaps of knowledge, but they're not written in a way for submission to a journal. But interestingly, a previous mentee who is now in med school, Kevin Zhang, he reached out recently to say he wanted to do this systematic review about music to manage stress and anxiety during COVID-19, and was wondering if there was any mentees who would join the team to write the paper. And so, of course, we have such a great team of different mentees, and two, so Catherine Zhang and Rena Tabuchi. So Catherine's an undergraduate student in health sciences, and Rena is an undergraduate student in music therapy in the States. And so they collaborated to write this paper. So this is an example of how we were able to come together, how the mentorship program facilitated this teamwork to do this research, to bring together a paper, which we have now submitted for publication. And then earlier this year, we had a paper published, Biomarkers of Stress in Music Interventions, a systematic review. And so in working with a mentee who was an undergraduate student at McMaster University in health sciences. And we were talking about different biomarkers of stress that in regards to music, because as I'm going to speak about soon in my PhD research, I'm collecting data about the biomarker cortisol for stress. And we were wondering, well, what other papers have been written about biomarkers that are where music is the intervention and what biomarker is being used as the measure? And there hadn't been a systematic review on this, so we didn't know. And so this was an opportunity through the mentorship program to do this review to see how many papers do use biomarkers of stress in music interventions. And that paper was published earlier this year in the Journal of Music Therapy. Melanie Wong, who is the first author, is now in medical school. And I think that that's also a really important point, is that learning about doing these music therapy research projects is informing people who are about to become doctors. It's informing who's going to become nurses, who are going into other healthcare professionals. So I'm going to be talking about that later, but I just wanted to highlight that now as well. And also, as an example, the use of music therapy to improve mental health in forensic patients. So here, this wasn't a research that we submitted for publication, but it really helped to highlight, I'm going to share with you soon a slide that, there were actually only 3 papers that have covered this topic. And so not only does sharing this information help others within the public to know about music therapy, but it also helps us as music therapists to be more aware of where are the gaps in the literature. Where do we need to do more research? So this was really interesting when Justin came back and he's like, there's only 3 RCTs on this topic. And so it was really, these opportunities have been very good in informing about the overall lay of the land of research in music therapy. And the final example I wanted to share with you was research conducted by Rachael Aurora as a mentee. She was also in health sciences undergraduate student. And she completed a review of literature of the role of music therapy to address anxiety. And later completed her thesis also as a mentee. And it is through her work, actually, that I was inspired to do my PhD research, which I'm going to be sharing with you. So I'm very grateful to Rachael and to the mentorship program, because not only have I learned so much, and I feel that we've been able to share with the greater community what we're learning, it also inspired my further learning to go back and do research myself as a PhD student. And Rachael and I continue to do some work beyond her thesis. And we're actually going to be presenting her work at the 12th European Music Therapy Conference in Edinburgh in June of 2022. So if all is well and we're still able to fly and see each other in person, I look forward to seeing you in person if you're coming to the conference in June of 2022. So these are just a few examples of how educating through mentoring can support further research, which of course is a great tool for advocacy and increasing how many people are aware of the benefits of music therapy. And also sharing the benefits of music therapy with people who are pursuing healthcare careers such as medicine. And in Rachael's case, she's pursuing currently a master's in health policy. So we need these people on our side. So this is, I think, pretty good stuff. As mentioned, mentees can complete research or they can participate in social media projects. Blogs are an important part of community science. Members of the public, I mean, honestly, they're not likely to pick up a journal for pleasure reading. But a blog, however, can provide valuable information to the public, to other healthcare professionals, as well as our fellow therapists about research in the field of music therapy. Blogs also provide a forum for our mentees to learn about different music therapy approaches, music therapy models, and how different music therapy interventions are implemented. In our blogs, we also have interview series where Bernice interviews other music therapists around the globe. And these series can also help music therapists recognize that there are other people having similar experiences to themselves, that they're not alone, perhaps, in something that they're going through when they hear another music therapist talking about that in the interview. Also, the interviews help, I think, find new perspectives and learn from other music therapists' perspectives and experiences. We also have reflective blog posts, which have been written by new music therapists, as well as aspiring music therapists, as well as music therapists transitioning careers. So we're really broadly looking at all the conversations within our profession. We provide our mentees with free access to our webinars. And I do want to point out that actually when the Music Therapy Academy first launched, I was really against webinars. I really wanted only in-person workshops. And I really felt that that was integral to learning, having these hands-on interactions, opportunities to network with other music therapists, as well as with other healthcare professionals. But of course, logistically, there were people who couldn't come in person. So we did switch to the webinars, and of course, COVID, we switched to webinars, of course, too. So we have these webinars, which I have to say I am now very grateful for, and they've been a really great resource. And we provide this resource to our mentees, and then ask that they write a blog about what they have learned. And then this is a way for people to also know, like, do I want to take the time to participate in that webinar? Is that webinar really going to give me what I need? So by reading blogs, potential participants can also learn from what the mentee has written. And so I think that this is yet another way for the mentees to learn, and then extending their knowledge beyond that in the platform of a blog. So community science, so when we're talking about blogs and reaching out through social media, so community science is a great tool for educating people. They really are interested, I'm sure you know, they're really interested in learning about music and health, and specifically music therapy. People are usually very keen to want to talk more about, so what is music therapy and what is it you do? People are really interested. And I think the term music therapy itself is not necessarily so uncommon, but it is still uncommon for the general public to be able to define it and to know what is different or what makes music therapy different from a musician using music therapeutically in a long-term care facility, for example. So we need to educate in ways that are palatable. We need to translate all the awesome research into bite-sized pieces for people to readily absorb. So professional development. The Music Therapy Academy, as I had mentioned before, originally did set out for in-person workshops. So some of the images here are from when we had in-person workshops. And some of these we were able to record and have now created into webinars. And these workshops help to enhance the toolkits of music therapists and help other healthcare professionals to better understand music therapy, as well as the difference between using music within one's own scope of practice and actually doing music therapy. Giving others the tools and permission, so giving non-music therapists, like non-music therapy healthcare professionals, tools and permission to use music is important. More people using music within their own scope of practice is a good thing. Why? Because we know it works. We know music is a very powerful tool. And as long as it's being used within the skill set of the individual, within their own scope of practice, so much more can be achieved. In our professional development workshops, we do provide other healthcare professionals, such as speech language pathologists, physiotherapists, and social workers, with tools to use music within their own scope of practice. I've heard some music therapists not be so keen on the idea of other healthcare professionals using music within their work. And there are many reasons for this, such as the fear that others using music will take away jobs from music therapists. And the reality is that there are more opportunities to use music in healthcare than there are music therapists. And there just is. And if a speech language pathologist, a physiotherapist, a social worker, a teacher, if they can deliver their services even better by incorporating music, why not provide workshops through the lens of music therapy to help make this happen? This also helps other healthcare professionals to understand their own limitations of using music and to gain a better understanding of what a music therapist can offer. It really is a way to advocate for music therapy. And when other professionals know their limitations of using music, they're more likely to reach out to collaborate with a music therapist when they see what are their limitations. And so overall, this working together is a way to advocate for music therapy. So I provided a few examples here of some of the workshops we have offered, from running a private practice to workshops around self-care and music therapy within mental health, as well as further developing one's musicianship through the lens of music therapy. Now, if I'm going to promote the importance of professional development, I better make sure that I'm doing my part. And in order to keep advocating, I need to keep educating myself. And I need more resources. The field of music therapy needs more resources. So specifically, I wanted to add to the literature about the use of music therapy for proactive wellness. And recognizing the language of funders in healthcare, I set out to complete a PhD that collected psychological, physiological, and biomarker data. So I'm currently completing a PhD at McMaster University in Ontario, Canada, in the Department of Psychology, Neuroscience, and Behavior under the supervision of Dr. Laurel Trainer. I want to mention that doing a PhD in the Faculty of Science with a team of other students that are not music therapists has also been another way to advocate and teach others, because I'm constantly presenting about my work on campus and within my department. And so as a result, people are hearing about music therapy. And previously, there's never been a music therapist in the Department of Psychology, Neuroscience, and Behavior. So this has been a great learning opportunity, or a great advocating opportunity in all of the faculty, the students, the postdoc students there are now learning about music therapy. So currently, the standard of care for mental health in most Western healthcare systems is verbal therapy. And typically, mental health supports are crisis focused, meaning they're often promoted as being available for somebody who is in crisis, opposed to a support to engage in as a means to prevent crisis, which is very different from when we think about physical health. So very often we're told, eat well, exercise, sleep. These are all proactive means to manage your physical health so that you don't go into a physical crisis. And we're not there yet for mental health to that same degree. It's very normal and socially acceptable to go to the gym, to proactively manage your health. You don't go to the gym because you're in physical crisis. You go to prevent it, ideally, right? And so part of my motivation is to get to that same point with mental health. So there still does remain a negative stigma around reaching out for support for mental health. And many people do tend to wait until they are in a crisis. And this same culture exists on university campuses. So I want to know, does music therapy help to reduce stress and anxiety for university students proactively? The students in the study, they do not necessarily have a diagnosis, and they're not in crisis. So they are participating proactively, and they are engaging as a means to manage stress and anxiety. The research was originally designed to be in-person group therapy sessions, but of course, COVID-19, we're all online. And again, if you had mentioned prior to the pandemic that my research would be based on online group music therapy, I would not be having it. I just wouldn't be able to wrap my head around it. But here we are, and it's actually a gift from the perspective that now we can take the results of this research and we can replicate the study and in person and compare the in-person results to the online results. So it's ended up providing a gift, if you like, to look at things optimistically, that otherwise would never have been part of the PhD if it hadn't been for the pandemic moving this in-person study to online. So, so this research, I'm just going to give you a very brief overview here. We have our students are randomly assigned to one of 4 groups. There are 2 different music therapy groups, one that uses active music therapy interventions and another that uses receptive music therapy interventions. In the active music therapy group, we're not using improvisation, unfortunately, because it is online, but we are using singing and lyric analysis and songwriting. The third group is verbal-based therapy or standard of care. And the fourth group is a control group where the students don't receive any intervention for 6 weeks. So students are randomly assigned to one of the 4 groups. They participate weekly in their therapy session for 6 weeks, or if they're in the control group, they're doing no interventions for 6 weeks. And then we collect psychometric data about stress and anxiety. We collect heart rate variability as our physiological measure. And we take a hair sample at week 1 and week 6 of the study to compare changes in cortisol. So we take the hair samples are sent to a lab where they are analyzed for cortisol levels, which is a biomarker of stress. And the really cool thing with hair samples, so the really cool thing with hair samples is that they are 6 weeks retroactive, meaning in week 1, when we take the hair sample from the students, we get a reading of what was their stress like 6 weeks prior to engaging in the therapy sessions. And then they have 6 weeks of therapy, a second hair sample, and the second hair sample will tell us what was their level of stress like for the 6 weeks during the therapy sessions, right? The 6 weeks retroactive. So this is pretty cool. And I have to give a shout out to when I was at Anglia Ruskin University at the conference in September of 2019, and how great it was to connect with others there who were great resources about informing me about actually this tool of using hair as a means to measure cortisol, as this is still more of a upcoming way to measure cortisol, and being able to do so retroactively in these kinds of studies is very useful. So to date, 65 students, undergraduate university students, 65 have participated in the study. We're still running the study. We're actually starting another block of the study tomorrow. And then we'll be running another block in January with the goal of having up to 200 students participate in total. So again, right now we're only at 65, but we are seeing statistically significant reductions in stress and anxiety in the psychometric measures before and after each of the therapy sessions. And that's both the music therapy sessions and the verbal therapy sessions. So good news, the standard of care works. This is good, that's good. And music therapy is just as good as the standard of care. It should be considered as a standard of care. The results are the same. However, what is not the same about the music therapy groups and the verbal groups is attrition, attendance. We have over 85% attendance to the music therapy groups, and it's about 60% attendance for the verbal therapy group. So we may have all the evidence in the world about an intervention being efficacious, but if nobody's going to come to that intervention and participate, it's not going to be very effective. So that's a really strong point about music therapy for proactive wellness. If students are going to engage, they're going to get more out of it. And it's possible, this is just a theory, that there isn't the same negative stigma associated with music. And for that reason, students may feel more readily to engage. Like music is something that students, most individual students or not, are already regularly engaging in. So the other thing in regards to the cortisol measurements, just to go back to the results, is that we see a reduction in cortisol levels in the therapy groups. And we actually saw an average increase of cortisol in the control group. Now, those findings are not statistically significant. We only have 29 students. We only had 29 students who submitted the hair samples. So out of our total of 65, we only have 29 readings from the cortisols. So again, we see an average reduction in cortisol in the therapy groups, an average increase of cortisol in the control groups. But again, we only have 29 students. It's not statistically significant. Because we're online, the students are being asked to do their own hair sample. It's a little hair from the sample from the back. They're being asked to do their own hair sample. And so it's completely on them to then put it in the package that we send to them and then mail it to the lab. If we were doing this in person, then we would have 65 hair samples matching our 65 participants. But that's the world of online research. So I've mentioned the results so far and about the attendance. And yes, and now just to go back to the mentorship program. So here we are in this research, we're seeing students do want to engage in music therapy. We're seeing that it's effective. So there was a student in the mentorship program who was interested in doing a project about what do wellness programs look like at other universities across Ontario. And reality is there's none that are offering music therapy on campus. They're not offering creative therapies. They're not providing students with choices to proactively engage in wellness outside of verbal therapies. So that's pretty important to recognize that there's a gap there. And meanwhile, we are collecting evidence to support that music therapy is as effective as the standard of care, appears to have less stigma, appears to have greater engagement, needs to be offered. So completing a PhD is providing me with the education and the tools to advocate for proactive wellness on campus, and specifically the use of music therapy for proactive wellness on campus. My goal is to take the findings and to apply them to proactive wellness in all settings. We know that for dementia care, for example, so many behaviors that are observed in a long-term care setting could be prevented. So many symptoms of dementia are exaggerated as a result of enhanced stress and anxiety, which we can proactively prevent. So these are some examples of how this research can also transcend beyond the university campus. I've provided a link here for a 1-minute video. So I think that it's just going to be provided to you, so you can watch that on your own accord. It's just 1 minute, nice, short, and succinct, which just kind of wraps up what I said here. Feel free to watch that anytime, share it, reach out to me with any questions about it. There we go. Okay, so moving on from there. Yes, Helen.
Thank you so much, Rachel.
Oh, am I wrapping up? Am I done?
Well, we have till 6:30, and we've got 2 questions, so you could perhaps talk for a couple more minutes. It's fascinating. Sorry to interrupt, but we go offline at 6:30,
yes,
so we have to.
Yes. So 30 seconds just to say, advocating through teaching. So as mentioned, teaching at McMaster to all undergraduates, like does it not just music therapists. So just wanted to mention about how important it is to teach others beyond the field of music therapy. Kiara is going to share some links to some take-home tools from some professional development workshops that we have provided. So there's a few freebies here for you to access. And in summary, this is the importance of community science. People don't know what they don't know, so we got to tell them. The importance of educating non-music therapists, how mentoring can not only be rewarding in how we help others, but can also give you time to do projects you didn't think you had time for, and how we are all students ourselves and how important it is to continue with that. So that's it. That's a wrap. Thank you very much.
Thank you. Really rich tour, I have to say, across so many different levels and so many different areas that we could now spend another, few hours discussing everything. And I mean, I think what you say about broadening the scope and engaging with others in different fields is very dear to our CIMTR way of thinking, and not to treat what we have, which is very unique, in a way that we can't use it to help in so many different ways. And so you probably know about the Homeside project, which is
amazing. Yes.
So I just no, I mean, I'm not. It's your time, but I suppose there's so many different areas that you've talked about. It's really important as well, and we've been thinking about broadening modules, to run across the university. I know they do that in the University of Melbourne as well, and other places, in an introductory way. So it's really it's fantastic what you've achieved, and all the varying research areas, forensic research and working with people with dementia, and then this very important area of working with students and their wellness, and people's wellness in general. So, I mean, we can't do that justice, and we've only got 5 minutes, and we've got 2 questions, probably more will come. And the first one is from Jodie Blosker. For your PhD study, at what point in the term will they receive the intervention? I could see this having an impact on cortisol levels, for example, beginning of semesters versus near midterms, etc. And I think, just to say, Jodie is a fellow of I think even went to your university, I think.
Yes. Hi, Jodie. Yes. So we actually run these blocks of 6 weeks continually in order to account for that variable. So we have, fall semester, winter semester, spring semester, summer semester, in order to account for that. And we also rotate our therapists to account for therapist effect, because you're absolutely right. Different times of the school year are very different for stress. Yeah. Great point.
Okay. Yes. And also Katie Richards has said, fascinating research. So interesting to hear about this. I've recently been in discussions about providing music therapy groups with university students myself. That's great to hear. What kind of receptive music therapy are you doing? And did this include GIM, which is guided imagery in music, for anyone here who's not so familiar with it? So over to you.
This is great. I really hope you do go forth with this, and feel free to reach out to me. I'm happy to support in any way at all. The receptive is only listening to music, but meaningful, like not the music therapist, like choosing what you're going to listen to, but based on discussions with the students. They collaboratively talk about what they're going to listen to. They listen to it and then they have discussions. So we're not doing GIM only because that then is a whole other, because it is a whole other approach. We're just using like music therapy in its general terms with its most general interventions of active, receptive. So even though GIM is receptive, but we're just doing listening, meaningful listening and discussions.
Thank you. I had a question because there aren't any others and we've still got a minute or two, which is about funding. So, you know, you talked a lot about opening up for mentorship, and it is really interesting that you didn't find many programs and not much discussion in the literature. I think there might be some things happening that, yes, haven't been published probably. So that's a really good jog to the world out there to make sure that we do put out there what's happening. I think, you know, we have different terminologies for all these things, but you have this very structured mentoring program. For example, how is everything funded? Do people pay fees for that? Or yes, right. I suppose I'm interested in how it all works.
Yeah, it's a passion project. There's no funding for the mentorship. So the mentees do not pay to be in the mentorship program. We do not financially have any financial gain from the mentorship program. So we give our time to mentor the students, and then the students give us resources. So, you know, I'm going to have a documentary. The Music Therapy Academy is going to have a documentary. We've created a video about history, the history of music therapy. We've been able to participate in conferences and have material. So there's no financial gain. It's all priceless education and knowledge gain.
Thank you so much. That's really inspiring. It's been a really inspiring time, Rachel, and thank you so much. I'm sure people would be clapping if they could. And there's lots of comments in the chat where people are putting their very positive feedback. So I'm going to now thank you very much and want to keep in touch and collaborate maybe on some of these things, and hand back to Kira.
Yes, thank you very much, Rachel, for your presentation. Just like to say, please complete the survey after we finish at 6:30 tonight. And also please join us for our next webinar on the 15th of November with another alumni of ours, Jamal Glint, looking at music therapy and mental health in Trinidad. Thank you very much again, Rachel. Great presentation. Thank you.
Thank you.